There are many different types of memory loss, and it is broadly characterized as a neurological disorder that inhibits the storage, retrieval, and encoding of information. However, to understand memory loss and all the different types, memory itself needs to be explained. Memory is defined as the mental ability to store, retain, and recall information. Memory is divided into three different categories: sensory, short-term, and long-term memory. Sensory memory is the initial memory the body produces as a response to a certain stimulus. It enables a person to remember something just seen, heard, or felt. This then transfers to short-term memory. Short-term memory is dependent on the frontal and parietal lobes of the brain. When the information within short-term memory is rehearsed, then it is converted to long-term memory. Long-term memory is maintained through neural connections throughout the brain. It has the ability to maintain a much larger realm of information than short-term memory. The hippocampus is a part of the brain that is largely associated with memory. Although memory itself is not stored here, the hippocampus is responsible for transferring short-term memory into long-term memory. If the hippocampus is damaged due to trauma or surgery, then the brain must develop a new neural pathway to store information. This can be a time-consuming process and may take up to 3 to 4 months. Memory loss can occur for many different reasons, and there are many different types. Researchers and scientists have still not been able to pinpoint exactly what happens physiologically for memory loss to occur. In other words, they have not gathered whether or not it is a person's inability to retrieve information, encode information, or if it is just accelerated forgetting. Memory loss can occur due to trauma, degenerative aging, or rarely some type of genetic mutation. Certain types of memory loss occur from the progression of a certain illness. There are many different aspects of memory loss, and each illness may result from many different issues. One type is amnesia, and this generally occurs as a result of physical or emotional trauma. People who suffer from amnesia usually lose the ability to recall facts but retain their procedural memory. This is being able to remember how to perform certain actions such as reading and writing. There are many different types of amnesia: antegrade, retrograde, transient global, childhood, lacunar, and source. Anterograde amnesia typically occurs after some sort of brain trauma, but can also be drug-induced. This inhibits a person's ability to recall events prior to the onset of trauma. Remote memories are usually more accessible than events just before the trauma. Reintroducing familiar objects helps with the jogging of a person's memory. Transient global amnesia causes people to forget things beyond a few minutes. This type of amnesia can be detected through an MRI because abnormalities will appear in the hippocampus. The cause is unclear but could possibly result from blood flow reduction or a seizure. Childhood amnesia is the inability to remember childhood events. This may occur from trauma, but may also occur from developmental problems with language. Sigmund Freud believed childhood amnesia to occur due to sexual repression. According to this theory, traumatic events occur during the psychosexual development of children, so these years would be forgotten. Lacunar amnesia is the loss of memory of one specific event. This is almost always due to brain trauma. Source amnesia is when you are able to recall information but unable to remember where you acquired it or why you know it. A different type of memory loss disease is Alzheimer's disease, or AD. Alzheimer's is a brain disease that causes progressive memory loss and is usually fatal. Alzheimer's is caused by an increase in production of beta-amyloid protein, which leads to nerve cell death. This causes deficits in neurotransmitters, which are chemical messengers in the brain. There is no specific cause, but there are certain risk factors that can lead to the development of this disease. Unless diagnosed with early onset Alzheimer's, this disease is usually not identified until old age because thinking processes generally slow down. Other risk factors include hypertension, diabetes, high cholesterol, coronary artery disease, or genetic mutation. Women are also more likely to be diagnosed with AD, and researchers are studying how estrogen levels may contribute to this. Symptoms of this disease are recognized by confusion, short-term memory loss, and problems with abstract thinking. According to the National Institute on Aging, doctors and researchers are performing numerous clinical trials to search for new treatment methods and cures. There are certain memory loss problems that do have a distinct identifiable cause. Korsakoff syndrome is a brain disorder that causes memory loss due to a lack of thiamine in the brain. Malnutrition and chronic alcoholism are specific causes of this disease. Lack of thiamine can cause damage to the medial thalamus and hemorrhaging in the mammillary bodies within the brain. This also causes gliosis, which is damage to the supporting cells in the central nervous system. Symptoms of this disorder include apathy, tremors, and in some cases can cause paralysis to the muscles surrounding the eye. According to Health A to Z, Korsakoff syndrome inhibits the ability to retain and remember new information. Another common memory loss problem is the blackout phenomenon. Blackouts are partial or complete memory loss due to the overconsumption of alcohol. Blackouts have similar effects to anterograde amnesia in that memory loss only occurs while too much alcohol is being or has been consumed. The overabundance of alcohol inhibits the brain from converting short-term memory to long-term memory because the hippocampus is temporarily impaired. These are, of course, not the only memory loss disorders, but these are the primary ones that affect the largest amount of people. Besides the physiological problems associated with memory loss, there are many emotional problems that occur as well. Memory loss is a devastating problem for the person affected and also their friends and family. In the advanced cases of Alzheimer's disease, family becomes unrecognizable. Not only is this traumatic for the victim, but this is a huge emotional struggle for those close to the victim. They often feel alone and scared because they have no idea who to trust. In cases of amnesia, or those that have suffered severe cases of memory loss, relearning is a time-consuming and frustrating process for everyone involved. Memory loss is tragic, and researchers are doing everything they can do to find a cure.